Hi everyone and welcome back to the Art of Medicine. I'm Dr. Motahare and today we are talking about a really important question. Is pneumonia contagious? We will talk about different causes of pneumonia, how it spreads and what you can do to protect yourselves. So grab a cup of tea and let's get started. So what is pneumonia? Pneumonia is an infection of the lungs that causes air sacs, which are known as alveoli, to fill with pus or fluid. This can make breathing painful and limit oxygen intake. It can affect just one lung called unilateral pneumonia or both lungs, bilateral pneumonia. Symptoms can range from mild to very severe ones and include severe coughs, high degree fever, chills, and shortness of breath. Pneumonia is particularly important in different groups. One of them is children younger than 5 years old, and the other one is adults older than 65 years old. People with chronic illness, like diabetic patients or patients with autoimmune disease, and also patients with weakened immune systems, like HIV infected patients, are more prone to severe pneumonia. Think of your lungs like sponges. When they filled with the infection and fluid, your body struggles to breathe and absorb oxygen. So, what causes pneumonia? Pneumonia can be caused by different types of infections, each affecting how the illness spreads and how it treated. The first one is bacterial pneumonia, most common cause in adults, often caused by Streptococcus pneumonia. It may develop on its own or after a viral illness like a flu, a super infection. It means that first it was a viral infection, and in the time, bacteria just start to grow and cause a bacterial pneumonia. The second one is viral pneumonia, common in children and can be caused by viruses like influenza, respiratory syncytial virus, and COVID-19. And the third one is fungal pneumonia. This is rare, typically affect people with weakened immune system, causes by fungi such as histoplasma and cryptococcus, and also pneumocystis jirovecii in patients with HIV. The cause of pneumonia doesn't just change the treatment, it also affects how contagious the illness is. So let's talk about the main question. Is pneumonia contagious? The answer is not straightforward. It depends on what caused the pneumonia. Viral pneumonia, yes, very contagious. Viruses like flu and COVID-19 spread easily from person to person. Bacterial pneumonia, again, yes, especially some types like Mycoplasma pneumonia, which can spread in places like schools or households. Fungal pneumonia, no, it's not contagious. Fungal spores are inhaled from environment, not from the infected people. So, while not all pneumonia is contagious, many cases can pass from person to person. How does pneumonia spread? It's so simple, like cold, coughing or sneezing. Respiratory droplets, saliva, carry the virus or bacteria through the air. Close contact, hugging, kissing, or sharing food or drinks with an infected person increase the risk. The other one, contaminated surfaces. Viruses like influenza or COVID-19 can live on surfaces for hours. If you touch a contaminated object and then touch your face, you could become infected. Pneumonia doesn't spread as easily as cold, but certain types can be very contagious, especially in crowded places. For preventing pneumonia, we have some good options. One of them is vaccination, like flu vaccine or pneumococcal vaccine for high-risk groups. Also, washing the hands, avoid smoking, eat healthily, and get enough sleep all help you to improve your immune system. Staying away from sick people and wearing masks in the crowded places can help too. The next important question is when to see a doctor. You should seek medical help if you or someone you care for has any of these symptoms. High fever, especially with chills and sweating. Shortness of breath, rapid breathing, hard breath. Persistent cough with yellow, green, or blood mucus. Feeling confused or weak, especially in older adults, that symptoms may not be clear. Older adults, symptoms are very minor, and we should be aware about this matter. That any simple change in their daily life can be a sign of a very serious problem. Delaying treatment can lead to complications like sepsis, which means blood infection, respiratory failure, and lung abscess. Don't wait until you are gasping for air. Early treatment saves lives. To sum it up, pneumonia is a serious illness that can be contagious, especially when caused by viruses or bacteria. Knowing the cause is key. Preventing through vaccination and health habits can save lives. Thanks for watching. Don't forget to like, subscribe, and share if you found this